Many nursing assistants work in long-term care settings, where residents live for assistance with chronic medical conditions. Chronic health conditions are health issues lasting more than 6 months and often require specialized interventions to maintain the individual's highest possible level of health and functioning. Acute health conditions in long-term care settings are typically related to the resident's rehabilitation process, an infection, or an injury. Nursing assistants also work in hospital settings, where patients with acute health conditions can experience rapid changes in their condition. These changes must be promptly communicated to the nurse so they can be addressed quickly. In this module, you will learn how to meet the needs of residents with chronic conditions related to developmental disabilities, mental health disorders, and dementia. You will also be introduced to providing care for patients with acute conditions that require additional safety or behavioral interventions. In the past, individuals living with mental health disorders or developmental disorders were viewed as unable to be a part of general society and were often placed in large institutions with little to no access to the outside environment or the community. This unfortunate stigma was due to a vast misunderstanding of these diagnoses. We now know this misconception is detrimental to individuals, and legislative and societal changes have been made to better meet the needs of these individuals. As a healthcare professional, it is important to understand how you can continue to improve the quality of life in individuals with these diagnoses through your communication, awareness, and approach. Historically, facilities for institutionalized individuals looked like the Willowbrook State School pictured above. Residents were typically cared for in large spaces and group settings, and eating at long tables with little space for comfort. Often, residents slept in large rooms with several beds in close proximity to each other, with no accommodations for privacy or noise reduction. This care environment often caused overstimulation, resulting in sleep disturbances and client behaviors that were difficult to manage. In contrast to current healthcare practices, individual preferences were not prioritized. These institutions lacked funding, professional caregivers, and basic knowledge of what residents needed to successfully function to the best of their ability. Because of these conditions, individuals with developmental or behavioral health disorders were often looked down upon, shunned, stigmatized, vilified, criminalized, and, in some cases, imprisoned or tortured. This type of inhumane treatment has been documented as far back as the Middle Ages in Europe and up until the mid-1900s in the United States. In the United States, this type of care environment continued until 1963, when President John F. Kennedy signed the Community Mental Health Act.